Welcome to Extra Mile Medics, where we seek to make your journey in school easy and enjoyable. If you are curious of how your urethra works, you might want to stay a little longer because today this video will address the anatomy of the male and female urethra. Before we jump into the video, please make sure you are subscribed to the channel. We will begin with the topography of the male urethra. The male urethra allows urine and semen to pass out in males. It is 18-20 cm long. It extends from the internal urethral orifice in the urinary bladder to the external opening of the penis. Divisions of the male urethra. The male urethra can be divided into 4 parts. 1. Prostatic part. 2. Prostatic part. 3. Membranous part. 4. Spongy part. Internal structure / microscopic structure. First, we'll begin with the prostatic part. It is within the walls of the urinary bladder. It extends to the prostate with circular cuff of smooth muscles. The sphincter contracts, but there is no ejaculation. 2. Prostatic part 3-5 cm. Small blind-ended. Traverses the prostate gland. Lumen of urethra is marked by a midline fold of mucosa. There are prostatic sinuses where prostate ducts empty into. 3. Membranous part 1-2 cm. Traverses pelvic floor. It is narrow and passes via deep perineal pouch. Surrounded by muscle of external urethral sphincter. 4. Spongy / penile component. Embedded in spongy body of penis. It runs to external urethral orifice. Bulbourethral glands and Litters glands enter here. Terminal part is dilated to form a navicular fossa. Lymphatic drainage and innervation. 1. Internal iliac nodes for prostatic urethra and membranous urethra. 2. Anterior urethra is drained by deep inguinal nodes. Innervation. 1. Prostatic plexus. 2. Parasympathetic nerves from the 2nd to 4th sacral segments. Blood supply and venous drainage. Arterial supply. 1. Prostatic branch of inferior vesical artery and middle rectal artery. 2. Urethral artery arising from internal pudendal artery. 3. Dorsal penile artery via circumflex branches on each side. Venous drainage. 1. Interior urethra is drained by dorsal veins of penis. 2. Posterior urethra drained by prostatic and vesical venous plexus. I hope you are still here with us. Now we'll talk about the topography of the female urethra. Allows for urine to pass to the external environment in females. 1. It is shorter than the male urethra. 2. It is 4-6 centimeters. 3. It connects bladder to external environment. Parts of the female urethra. 1. Internal urethral orifice located inside the urinary bladder. 2. Intramural part runs through the urinary bladder wall. 3. Pelvic part is the longest section located between the urinary bladder wall and the pelvic floor. 4. Perineal part passes through the perineal muscles and urogenital sinus. 5. External urethral orifice protrudes as the urethral papilla in the vestibule. Lymphatic drainage and innervation. 1. Paravesical nodes to common internal and external iliac nodes. Innervation. 1. Parasympathetic preganglion fibers from 2nd to 4th sacral segments of spinal cord. Blood supply and venous drainage. Arterial supply. 1. Intramural part inferior vesical artery. 2. Pelvic part uterine and vaginal arteries. 3. Perineal part internal pudendal artery. Venous drainage. 1. Intramural part vesical venous plexus. 2. Pelvic part vaginal venous plexus. 3. Perineal part internal pudendal veins. Thank you for reaching the end. I trust that this video was useful to you. Please give the video a thumbs up, share and join the family by clicking the subscribe button. See you next time.